Hello, and welcome to this segment of EHR Institute's InTech Brief, where we bring you up-to-date news that affects today's EHR professionals. I'm Jeffrey Erb, your host for the show. Meaningful use is just about all you hear in the media these days as it relates to HIT. It's making some people very nervous, however. In fact, 8 in 10 hospital CIOs said they are concerned or very concerned that they will not be able to demonstrate meaningful use of electronic health records by the government's 2015 deadline, according to a survey released Tuesday by PricewaterhouseCoopers Health Research Institute. The report, called Ready or Not, On the Road to the Meaningful Use of EHRs in Health IT, is based on a survey of 120 hospital CIOs who are members of the College of Healthcare Information Management Executives. It found only half of the hospital and health system CIOs surveyed say they will be prepared to meet the first set of meaningful use requirements and apply for incentive bonuses in 2011, the first year they are available. CIOs interviewed for the report said they were also concerned about meeting later stage requirements within the specified timeframes. The requirements include advancing care processes through decision support, providing and populating patients' personal health records, and improving health outcomes through data sharing outside their own organizations, such as with insurers, patients, and other providers. The promise of stimulus funding has accelerated EHR adoption and the collection of massive amounts of electronic health data as hospitals and physicians across the country race to meet eligibility requirements. But the existing infrastructure to support meaningful use of EHRs on a national health information superhighway is insufficient, according to the CIOs interviewed by PricewaterhouseCoopers. Yet, are the new meaningful use guidelines enough to improve the standard for quality? Some Republican members of the House Ways and Means Health Subcommittee do not believe so, and used a hearing on July 20th to challenge the meaningful use requirements. Much less is expected from the healthcare providers receiving subsidies under the new measures than what the Centers for Medicaid and Medicare Services had initially proposed. Physicians from all walks of life are getting involved. A physician from a small general medical practice in Saugerties, New York, was one who testified about his use of healthcare IT before the House Committee on Ways and Means on the Subcommittee on Health on Tuesday. Eugene Heslin, lead physician at Bridge Street Medical Group, described to the committee what role federal incentives are likely to play in physician uptake of health information technology. David Blumenthal, the nation's healthcare information technology coordinator, also testified. Beginning in October, billions in Medicare and Medicaid incentive payments will become available to healthcare providers who can demonstrate meaningful use of electronic health records. Heslin has used electronic health records in his 6-physician practice since 2006. In 2009, Bridge Street Medical Group was among 11 practices with 237 primary care physicians operating at 51 sites across New York's Hudson Valley that adopted the patient-centered medical home model and used health IT to support practice redesign to this new approach to care. He said that he speaks on behalf of his patients, representing their stake in health IT. Ultimately, it's his patients which are meaningful, and that's why health IT is important. Although financing and practice workflow redesign are challenges for small practices, he said the federal incentives can help him persuade his colleagues that there is critical mass, that it is doable at the community level, and that they need to move now along the same pathway to benefit their patients and the community. Heslin said that the time is now to develop efficiencies and logic systems that allow us to rationalize care, to care for our patients using more intelligent tools, more efficiently, and not to ration care. Meaningful use moves us in that direction. And the Medicare population doubles over the next 20 years, the number of more complex patients will increase at the same time the number of primary care physicians is decreasing, he said. Also in the news, it's been announced that the FCC will fund rural health broadband communications. The Federal Communications Commission has approved a program to invest up to $400 million annually to expand broadband connectivity for telemedicine and other medical programs in rural communities. The FCC has prepared a notice of proposed rulemaking establishing the program to be published in the Federal Register during the next month. The proposed rule would make changes to the Federal Universal Service Fund's healthcare support program consistent with recommendations in the National Broadband Plan, which the FCC issued in March 2010. The FCC intends to partner with public and not-for-profit provider organizations to invest in new regional and statewide broadband networks to connect clinics, hospitals, skilled nursing facilities, renal dialysis centers, off-site administrative offices, and data centers. Under the proposal, the annual $400 million from the Universal Service Fund would pay for 85% of infrastructure costs to develop broadband connectivity and 50% of recurring monthly costs for access to broadband services. The National Broadband Plan estimates that 29% of federally funded rural healthcare clinics lack access to even mass market broadband. This new program would be focused on closing the connectivity gap that exists throughout the country, according to the proposed rule. And finally, the Centers for Medicare and Medicaid Services and Office of National Coordinator for Health Information Technology on July 22nd will conduct a 90-minute audio training on the final rules to establish the Meaningful Use Incentive Program and adopt data standards implementation specifications and electronic health record certification criteria. Both rules were released on July 13th and will be officially published July 28th in the Federal Register. The teleconference starts at 2 p.m. Eastern Time. The phone number is 877-251-0301. Passcode is 878-41621. Well, that's all for this segment of EHR Institute's InTech Brief. Don't forget to visit us online and interact with your peers involved in EHR at www.ehrinstitute.org. Thank you very much.